Dr. Patrick Barousse. I'm an orthopedic surgeon with North Oaks Orthopedic Specialty Center. I'm a foot and ankle specialist, and today we're going to be talking about ankle sprains. And so if you have any questions, please feel free to write in and ask.
So Dr. Barousse, what happens when you sprain your ankle?
Sure. So ankle sprains are a very common injury. In fact, over 250,000 visits to the ER each year occur from ankle sprains. And typically what happens is people will have what we call an inversion injury in their ankle, where they roll it and they damage some that go on the lateral aspect of the foot. These can vary, ranging from mild, moderate to severe. Mild you can think of as a little bit of swelling. Moderate, you may have swelling the size of a golf ball. And then severe, you can get all the way up to tennis ball or grapefruit size. That's kind of a standard way to think about it.
So what should I do if I sprain my ankle?
So if you sprain your ankle, there's a number of things. The first and probably, or one of the more important, it's pretty basic, but it's price, which is rice, ice, compression, elevation, sorry. And that's for the more minor sprains that don't give you too much trouble. One of the things to consider when you sprain your ankle is how bad it's injured. So if you're able to get up and walk around and have minimal swelling, the price is typically a pretty good thing to follow. Now, if it's more severe and you have difficulty walking, then it's probably good to come in and get checked out for an x-ray just to make sure that you didn't break anything in the ankle or the foot.
So when and where should I go to get an x-ray?
Sure. So for those mild sprains, like I said, you may not even need an x-ray. Some of that depends on how severe your symptoms are. But obviously if you have that difficulty walking, it's prolonged, it's hurting for a long period of time, like over a couple of days, then you can do a number of things. One, you can go to the ER. Another would be to be an urgent care, your primary care, or you're welcome to come see me for an evaluation.
Usually how long does it take a sprained ankle to heal?
So for those mild ankle sprains, it typically takes around a week. For the mild to moderate, it's more around 2 weeks. And then for the more severe ankle sprains, it can take even out to 4 to 6 weeks before they fully improve.
And what if I sprain my ankle frequently? What does that mean? And how can you help me?
Sure. So recurrent ankle sprains are a common issue. Most of the time, after initial sprain, about 85% of people get better. That 15% that don't, that have recurrent sprains or recurrent feelings of instability, the first thing we would try would be bracing, some physical therapy. If those things don't help you, there is a fairly minor surgery where I can go in and tighten up those ligaments to really give you some good relief. And most patients are very happy with this, especially after years of suffering with ankle instability.
So what type of physical therapy is recommended?
Sure. So with treating ankle sprains, we found that in the past, people used to be immobilized for a long time, and really our study noticed that the physical therapy and more of a functional rehab is very important. And so when you're doing therapy, they're going to work on things like ankle range of motion. They're going to work on neuromuscular control, which is managing the muscles going down that's connecting to the bones in your foot, as well as proprioceptive training, which is things like balance balls and just other modalities that can help get you to recover a little bit faster.
And then what type of braces do you recommend, or what type of braces can be used?
Sure. So there's a few different type of braces. Most ankle sprains, a simple lace-up ankle brace, something that looks like this, does a really good job. It can help with the swelling. It can also help give you that protection and rest while you're going through your acute phase. Sometimes we have ankle sprains that are more severe and people have a lot more swelling and more difficulty walking, and we may go something a little bit more robust, which is a cam boot, which looks like this. And then we have some products in between that are more solid ankle braces, but that can still fit in a normal shoe.
Awesome. Is there anything that I can do to prevent ankle sprains?
Sure. So One of the things you want to do, certainly if you're going to undertake any athletic activities, is stretch and warm up. Maintaining good proprioceptive control and muscular balance is very important. Ankle bracing is also very effective in preventing recurrent ankle sprains. We found that in patients that have had ankle sprains in the past, if they wear an ankle brace during their sporting activities, they can decrease their rate of ankle sprains by close to 65%.
I think that's all the questions that we have today. Do you have anything else that you'd like to add?
If you experience any ankle sprains or have any chronic ankle sprains, don't wait to make an appointment with me. You can call 985-230-BONE to schedule your appointment with me.
Thank you.